Are you looking to develop groundbreaking ideas?
Maybe you're thinking of making the move from academia to entrepreneurship or turning your research into a business.
Or maybe you're the CEO of a startup looking to hire.
How about working with our team to organize your own workshop or webinar?
Whatever your thing is, we guarantee you'll find like-minded members in our network of innovators.
Our community connects every corner of Europe and beyond, creating a global wealth of expertise and ideas.
You'll also get discounted access to conferences and training, career development, and mentoring.
The Innovators community team is here for you, so don't be shy.
Let's shape the future of healthcare together.
So sign up and build your profile now.
Sorry. So that was a brief introduction about the EIT Health Innovators community. And we have been building this community for over several years right now, and we are currently around 4,000 plus people. We have entrepreneurs, researchers, scientists, CEOs, students, working professionals, everybody who's connected in the healthcare landscape within our community to share and exchange knowledge and partake in events. As a part of the community, you also get access to certain special events, discounted tickets to various conferences across Europe. So please do check out our community and sign up on community.eithealth.eu. Now with that, I would like to hand over the stage to our moderator for the evening, Sergio. Sergio, the floor is all yours. Please take it.
Thank you so much. Well, I'm going to introduce myself. I'm Sergio Gonzalez. I'm Innovation Lead at EIT Health Spain. And also, while I'm Program Manager of the DiGinnovation program, a program specifically focused for the reimbursement of digital health solutions. And it's what I'm going to, the program is what I'm going to present today. And also one initiative we have at EIT Health Spain, leading from EIT Health Spain, for establishing or trying to help to establish a reimbursement pathway here in Spain. Okay, so as I mentioned, I'm going to present this program. There's the innovation program that I'm managing at EIT Health. What is this program? Well, this program is part of the EIT Health Flagship Call 2024. It was part of the Flagship Call last year in 2023. It started in 2022. So it's a program that is becoming more and more knowledgeable, and we are very happy with the outcomes and we are having from the program, and also with the applicants the projects we are having in the program. It's part of the flagship calls. It's part of one of these specific flagships named Digital Transformation of Healthcare. It's in cut-off 2. That means that it's not currently open. It will be open in the second part of the year. Later, I will show you the different timeline and when you can apply to the program. The main goal of the innovation program is to ease the reimbursement pathway and accelerate the uptake of digital health apps by healthcare professionals and patients in Europe. Within the program, we select top digital health micro and small enterprises that have a CE-marked digital health app, and we pair these startups or micro and small enterprises with different top high-level partners around Europe to develop the project. The project must be collaborative and international, but well, it's a two-stages process. The first stage for sub proposal, the micro and small enterprise applies alone, and it's during the second phase of the selection process, during the super round, when the startup must create the consortium. Which are the conditions of the project within this program? And the project must have a maximum of 9 months length. The maximum grant from EIT is 250,000 euros. From that amount, at least 150,000 euros must be for the micro or small enterprise. The rest can be for the other partners of the consortium. The maximum rate is 70% among the whole activity's duration. That means that the consortium must co-fund at least 30% of the total budget. The solution must be patient-centered, and they have already been CE marked at the time of submission. The solution must also meet the requirements for the reimbursable applications in the targeted country. I will talk about the geographical focus later. And talking about the maturity, we're looking for very mature projects that can be in the market for clinical use and being reimbursed 1 year after the end of the project. Who can apply at sort proposal stage? As I said, well, at sort proposal stage, the micro or small enterprise must apply alone. And to be eligible to apply, the micro or small enterprise should follow the definition from the European Union. They will apply alone and then create a consortium at the later stage. The micro or small enterprise must be operational. It means that it has to have at least 2 paid FTEs, full-time employees, and the CEO working full-time. It must be registered in one of the European countries or in some Europe associated countries. They must have their own CE mark digital health hub at time of submission, and they must plan to receive reimbursement 1 year after the end of the project. The type of activities that can be supported by EIT Health in this program is the clinical trial design for evidence generation, the training for healthcare professionals, or different activities related with patient engagement, or activities related to include the innovation into advanced clinical practice workflows, the compliance with regulatory requirements, or activities related with pricing and business models of the solution. The expected impact would be the innovation, again, reaching the market and being reimbursed 1 year after the end of the project by maximum. More than 150,000 patients benefited from the solution, and also the training of healthcare professionals. Talking about the timeline, right now the program is closed. It will be open in June the 6th until the September 18th. This will be when the micro and small enterprises can apply for this program for submitting the sub proposal. After that, there will be different stages in the selection process of eligibility check and filtering, an evaluation for this proposal submitted in terms of a pitching day that the startups will be invited to pitch in front of a panel. The preselected ones will go into a support program when they have to build the consortium and also prepare the full proposal. And also the startups in this stage will go into a due diligence process. The deadline for submitting the full proposal and have the consortium built is 19th of December of this year. After that, there will be a remote evaluation and a final selection of the best projects. The notification of the final selection will be on January of 2025, the 23rd of January 2025, and between January and April, all the contracts will be signed and the project will start. Here you have the link to the program. Right now, the information is not updated, but it will be in the following weeks or months. Have in your mind that the call will be open on June the 6th. In terms of geographical focus, the applicants must target one European country, and among the European countries, there is no restriction. Applicants can target one of the fast-track reimbursement markets that currently we have in Europe, or a different country, getting the reimbursement from private insurance companies. There are existing reimbursement frameworks for digital health solutions like DiGA in Germany, PECAN in France, or mHealth in Belgium, that are the most advanced ones in terms of implementation. As you can see, Spain is some steps behind in this area, and it's something that at EIT Health we are very concerned about. And in that sense, I would like to introduce and give you some insights of one initiative led by EIT Health Spain, focused on the adoption of digital solutions in Spain and involving different stakeholders. This is the S3T project. The official name is a framework for a fast track of digital health solutions. In general, the existing digital innovation pathways are based on fast track processes that aims at accelerating patient access to the benefit these solutions can provide to the patients. But a fast-track regulatory process is just one piece to speed up the adoption. We consider that it is necessary to intervene in several points of the innovation pathways in parallel, in the whole pathway from ideation and development to market entry and adoption. And this is what the F3T project aims to do. The F3T project is an initiative that aims to bring together experts, healthcare innovation agents, and decision makers to define a framework that streamlines the adoption of digital health applications in Spain, while facilitating the path for innovators and entrepreneurs with actions to speed up the process, but not only in regulatory. The ultimate goal is to establish a roadmap and explore a possible scalable pilot for Spain. This project, the F3T project, emerged as a result of the different consultations and meetings that the IT Health held in 2022 to identify different obstacles in the path of innovation for digital health applications and the areas where it is key to intervene in a priority way. The objectives of this program is to promote reflection and guidance from experts, gather the knowledge and experience of Spanish and European ecosystems, bring together public and private sector stakeholders and decision makers with the idea to map the process and all the pains and bottlenecks that the process can have. To co-create feasible solutions that speed up the process from the idea to the adoption process. And also to raise awareness and urgency on the needs for this framework towards decision makers while offering feasible, ready to implement the solutions. Here you can see on the right, the different institutions that are involved in this initiative. We have different regions, we have big industries, we have hospitals, so it's quite multidisciplinary, the group. The project was launched in February 2023, and it is currently under development. The next steps will be the release of a final report and a call for action with the aim to design the first activity pilot and engage with different stakeholders and decision makers for the implementation of it. If you would like to know more about the F3T project, don't hesitate to contact us at EIT Health Spain, and we can provide further info, or even if you are interested in being part of this initiative as stakeholder, we would be happy to discuss about that. So with that, thank you so much for giving me the opportunity to present these two initiatives, and I will be at your disposal for any question. Thank you so much.
Thank you, Sergio. Yeah, so EIT, Sergio here is representing EIT Health Spain, and they have brilliant initiatives as F3T project and DiGinnovation programs to help fast track the digital health startups, digital health solutions in Spain. And now we have one more moderator for the evening who's going to be guiding us to this session. His name is Gonzalo. So welcome, Gonzalo. Please, the stage is yours. Please take away.
Welcome to the online event, Fast Track Reimbursement, Accelerating Digital Solution, where we delve into the dynamic landscape of reimbursement strategies. We will explore innovative approaches, cutting-edge technologies, and best practices that propel reimbursement process forward at an unprecedented pace. These events will be focused on digital health within the Spanish context, emphasizing the importance of safety, usability, and transparency in establishing successful digital solutions in healthcare. Well, the participants, who are founders of the innovative startups as ProCarement, TRAK, and Portabiles, will gain insights into the fast track process for digital health applicants. We will discuss requirements, validation criteria, and also the Spanish healthcare system, because at the end they were part of the innovation program. That's the reason we are mixing everything, and you will be inspired by their vision, their impact of these startups in how they are revolutionizing the healthcare through technology, and at the same time how they do their path through the through the reimbursement. So thank you again to highlight, Sergio, the EIT Health DiGinnovation program, the initiative that support the reimbursement pathway and accelerate the adoption of digital health apps by healthcare professionals and patients. So we are going to have a round table with the startups. But first of all, let's give 2-3 minutes of all of them. We have with us Carlos, the co-founder and CEO of TRAK. Also, we have Sebastian, the founder and CEO of ProCarement, and also we have Ralph with us in the stage, the co-founder and CEO of Portabiles. So please give us a quick intro. You start, Carlos, you follow Sebastian, and later you go, Ralph. And later we will enter in this round table with different topics. And Sergio, you can join to the discussion, and you, Krishna, whenever you think it's possible. Okay. Thank you very much and welcome, guys.
Okay, thank you first of all for the invitation to the EIT Innovators community. My name is Carlos Rodriguez Sierra. I'm one of the co-founders and actual Chief Operating Officer of TRAK. TRAK is a digital health software for healthcare providers so they can offer digital physiotherapy treatments powered by AI. Our solution enables the patient create a personalized care path, so it can perform all the therapeutic exercise for the musculoskeletal pathologies recovery, and we can monitor all the evolution through our AI. So actually, our company is based in Spain. We are working with several hospital groups and insurance company across the nation. So we are quite established in Spain as a leading solution in digital rehabilitation. And at the moment, we are looking for the expansion of our company. So at one point, we are working in the DiGinnovation program targeting the Netherlands, trying to introduce our solution to the Dutch market and to the Dutch healthcare system and trying to get reimbursed. And on the other side, on the other hand, we are also in the expansion strategy to Latin America. So at the moment, we are targeting to completely different markets, but with a strategy to be reimbursed in both of the health systems.
Thank you, Carlos, for the intro of your company. If you want to jump, Sebastian.
Thank you. And thanks for the invite. We are a proud member of the EIT network, as you know. My name is Sebastian Eckel. I'm the founder and CEO of ProCarement. ProCarement has started to develop these hybrid care models for cardiac patients. And we have launched a model for telemedicine or telemedical monitoring in Germany. And we built the first cardiological digital health applications for patients with heart failure. It's called ProHearts in Germany. Our goal is to provide healthcare professionals with all digital tools to enable them to work in hybrid care settings. The telemonitoring in Germany allows physicians already to provide the telemedical care to patients with heart failure, but just in a certain degree of severity. They need a license for this and have to provide certain evidences on a quarterly basis. It's more complicated for them. And the DiGA, the digital health application, is the chance and has a much lower entry threshold, as it allows the doctor to simply issue a prescription to all patients with heart failure and does not oblige healthcare professionals to take any action. The DiGA, as you described it already, is a very patient-centered solution in a self-contained model without any human or with any need of healthcare professionals to do any actions in there. This, however, is also the downside, is that without any reimbursement for issuing a prescription, so no chance for healthcare professionals to earn money with DiGAs, the doctors have naturally no interest in using the full potential of DiGAs. Like actively working with all the potential with this in all these applications. And here is, I see a much better approach in the French model, which actively integrates doctors into the process, that creates a greater acceptance among healthcare professionals. Nevertheless, we are seeing a continuous increase in the number of prescriptions and also in the number of healthcare professionals which are willing to prescribe. Moreover, it's not only registered doctors who are prescribing, but also hospitals and discharge management or rehab facilities which show interest and see the benefits. The DiGA increases care efficiency dramatically and the outcomes of the treatments. We stabilize patients at home, we detect emergency very early, avoid hospitals admissions or rehospitalizations. We can prove that we increase quality of life. And so there's a really true and strong potential in digital health applications, but we also see some potential for improvement in the regulatory frameworks, which we are, of course, happy to discuss with you. Still, it's a great chance for innovators to enter the health game.
Thank you, Bastian, for the intro. So, Ralph from Portabiles, your turn, please.
Many thanks. Thanks, Gonzalo. Yeah, I'm Ralph, founder and CEO of Portabiles Healthcare Technologies. We are a Germany-based company, and we are providing blended care to Parkinson's patients to help them to better cope and to better handle their symptoms, and also to involve the neurologists that do the therapy adjustment that is frequently required for those patients. So we are already reimbursed by some healthcare insurances in Germany. As Sebastian already stated, the German DiGA model does not allow neurologists or other healthcare professionals to be actively involved in the process. So we have our digital device and plus reimbursement for neurologists, plus reimbursement for telenurses. So we have own Parkinson nurses in our company, and we did that by directly negotiating so-called selective contracts with healthcare insurers in Germany. We were part of the EIT DiGinnovation project. Now we are in the EIT Health flagship for value-based healthcare. Currently running a project in Germany, Spain, the region of Madrid, to see how market access is working also not only in Germany, but also in other countries with hybrid care models as we offer. Thanks.
Let's jump to the rival, because many of you have been talk about the DiGA, that is the fast track reimbursement in Germany, but there are a few countries that are in the way to do this reimbursement program, because there are the French pecan, also in Austria there is going to be this one. But let's first talk about the public versus private reimbursement. What would be your advice to someone who would like to run a company and want to be focused on this reimbursement?
Yeah, from our experience, what we have seen is that private healthcare, when we are talking about acquiring new innovations, might be faster if you present proper cost efficiency outcomes. In TRAK, we've been enabled to get reimbursed by different private insurance companies across Spain. So also empowered by a hybrid healthcare model where different healthcare providers have been also involved in this process. But in our experience, the private healthcare is much more agile in terms of acquiring this kind of innovations if you present properly these cost efficiency solutions, and of course if your solution is also approved by the clinically validated outcomes, and if you complete all the regulations. On the other hand, public systems, it's true that they require like a lot of more validations and clinical data. And in our experience, we've been 3 years in the market, and we have not still got into the public reimbursement system. And on the other hand, with the private is something that we got really into. So from our experience, it's clear which one is fastest in terms of getting introduced to the healthcare system.
Yep. So I can describe it from the German perspective, as we went through the fast track clearance process in Germany for the DiGA. So it's a pretty well prescribed regulatory framework which allows startups to enter the market very early, so that you don't need long RCTs to really get all the health economic proof points to get into the public reimbursement. But you have this fast track system which allows you to enter the market way earlier. And if you're a startup and just you start with very limited resources in terms of cash, so it's important for you to generate a revenue very early. And this is something you really can do in the fast track system. So you still have pitfalls in the clearance process. And we also failed once, although we were very sure that we stick to the process. From our perspective, this still fulfilled everything, but they kicked us out once. And this took us another year to really accomplish the clearance process. So I think the value in it, it's really worth trying it. So try it out. Try the German fast track. It gives you still pretty fast revenue and the chance to really then do a bigger RCT to get more proof points, to get more experience with your application. And this also will allow you to accomplish other clearance processes in other countries as well, giving you true evidence.
Okay. Also, some ideas from my end. So we started in Germany with negotiating selective contract for reimbursement with some public healthcare insurances. In Germany, we have quite a fragmented market of public healthcare insurances, more than 100 public healthcare insurances and several dozens private healthcare insurances. This was more or less the reason was because we had good consultants that had excellent contacts to a number of those healthcare insurances. So we started with public healthcare insurances. On the other hand, private healthcare insurances are willing to spend more money actually for the same services as well, from a perspective of a digital health provider, but also from the perspective of healthcare professionals. So typically, doctors can charge sometimes nearly double the amount for their services with private healthcare insurances than they can do with public healthcare insurances. And if you want to involve doctors with own practices, it's a good idea to have also private healthcare insurances on board, because the doctors love it. And yeah, but still, this it's an uphill battle. You have to do it insurance by insurance, and only like nearly 10% of the citizens in Germany are covered by private healthcare insurances. So this is up to decide which is the best strategy for you, depending on what services you offer. As Sebastian said, if you have like digital-only services, DiGA might be a very good idea. If you have to involve doctors, private healthcare insurances is certainly something you should look into in Germany. I'm now looking forward to our flagship project with EIT Health with the region of Madrid that is partners, because I learned that in Spain you have regional payers and very often combined reimbursement by private insurances. So I learned that in Spain, many citizens have a combined reimbursement, partly from the region they're living in and partly from some additional private healthcare insurance. So I'm really looking forward to learn more about that system and how that will work out.
Mm-hmm. That's it. Yes. Like also adding what you say lastly, Rob, I think it's really important also to know properly what are or how is structured each health system, because it's true that when I can talk to you that you both are, know properly the German system, I mean, I could compare the same case in Spain and it's totally different. So I think it's really, really important to understand properly who are the payers in each moment, because it's true that in Spain we have the regional payers. Some services are also covered by what we call mutual insurances that cover also like work-related injuries. So I think it's really important to understand how is the structure of each market, because same happened to me in the Netherlands. So you can understand properly how you can enter your solution and which one would be the best path. So I think what happens in the health industry is that probably each market is totally different. So you need to understand properly where are you going so you can create the proper strategy for it.
There is a question from Glenn about the estimated overhead costs for applying and meeting the requirements for the programs. How soon is it profitable? There is, of course, no crisp number around that. It's strongly depending how strong your evidence already is. If you have a well-developed solution and you have the evidence, you can straight apply for DiGA in Germany. These are like just for the authorities, the number is not very high. It's like a two-digit K number. It's I guess around 20 to 30,000 euros. That's really not high. But depending if you also need to deliver special studies just for the clearance, you still have the way to do it in a very efficient way, because like as I said before, you don't need this big studies with thousands of patients, but like with 100 or 200 patients over a very limited period of time. You can start and finish the study within 1 year. So it's still a very cheap way with some 100,000s. Oh, and another question around pricing. So in the first year, during the study, during the fast track is running, you are free to fix your price. This was meant to speed the process up. So it sounds a little bit weird if a producer defines their own price in a public healthcare system, but it's really true that you can define your price for your DiGA in the first year. After that year, you will get an appointment for the final price negotiation. And what we see usually in Germany is that the price will drop by 1/2. Some companies could keep their price, and some had this drop by 50% maximum.
So if you negotiate selective contracts, you are more or less free to negotiate a reasonable price with healthcare insurances. But we did that quite transparently, doing the cost calculation, saying, okay, we take the average DiGA reimbursement for comparable devices like ours as a basis for the quarterly reimbursement, and add something for our additional services we provide with telenurses. In principle, for DiGA, I think the average is, Sebastian, maybe you know it more precisely. I think the average reimbursement per quarter is now around 200 and some euro. Is that still the case? So something like 800 to 900 euro per year. I think if you look at the PCAN, it's more transparent. They have a clearer description of the pricing there. That also depends then on the number of patients involved. So that's something I think is a good idea and would be a good idea also to have in Germany. So, but as mentioned, so typically if you discuss with private healthcare insurances, you can add, like, from a vendor perspective, another like 20 to 30% in principle. That is what I heard from other vendors. If you have contracts with public healthcare insurances, add some 20 to 30% for the contracts with private healthcare insurances. Maybe some additional services to differentiate a bit from the public system, but that is not critical to have. And maybe about something about the cost, because Sebastian very well described the process with the DiGA and the efforts and expenses. The interesting thing, if you negotiate with healthcare insurance, it really depends on if they like your idea. You don't even have to provide health economic validation of your system. Some say, okay, I first want to see a clinical trial that shows the cost efficiency or cost savings. So typically what you do if you negotiate contracts with healthcare insurances, you say, okay, you have like better services for your patients, ideally at lower cost. And some will say, okay, I want to see that clinical trial, which is always a bit difficult because to get really the data out of the system is not always so easy. But many healthcare insurance also say, okay, it needs to be plausible for me that we can do those, then that we can realize those savings, and it needs to be plausible for us. And of course, there need to be some clinical validation in general that the patients are treated in a better way.
So I would like to put a question to the panelists, like how can we put it forward in Spain, and what does it mean in Spanish context? How the medical reimbursement is done in Spain, and what is the current status right now? Can Ralph go first?
So the question is how, from my opinion, would be the best way to implement some faster in Spain?
Yes, we would like to know what is the current status in Spain regarding such a framework, and how do we go ahead about it?
Yeah. Okay. So in principle, it's from what I've learned so far is the same as we experienced in Germany. We need to talk to the region first, and to talk for additional services to the private healthcare insurances. So we have in our flagship project, we have SEMAS as the region of Madrid, and we have DKV Servicios in Spain as a private insurer. Currently, we are doing like the cost analysis with the partners to see, okay, what are like average cost for treatment of Parkinson's patients, to get an idea what are the numbers we're looking at. And then in the end, at the moment, it's like we did in Germany. You have to show what you are able to do better as the standard of care. And ideally, we are able to show some savings or at least some cost balance compared to standard of care. But of course, it would be a good idea also to implement something like, I'm a big fan of the PCAN because they involve the doctors. And I think especially in chronic diseases, That makes absolutely sense. I don't really appreciate the German DiGA system. I appreciate that they were the first ones to do something, but I don't think they did it well, at least not from our perspective. Some others are saying, okay, it's a good idea to have, but we also see that in many DiGAs, it's an issue if you want to have the patient to use the system continually. If it's only a digital device, the adherence will drop after a couple of months. So I would recommend for Spain to rather follow the French PCON idea and instead of a mere digital strategy.
Yes, that's a.
I absolutely can I agree to Ralph. So like keeping out the healthcare providers out of the care process, it lowers the acceptance. There is no sense from a medical perspective if you follow the patient journey or the pathophysiology of a disease. You must include the healthcare professionals at one stage, and you like keeping out rehab facilities or hospitals from prescribing digital health application makes no sense. This is something we learn now in Germany, but like this is something like I think a mistake which you can avoid. Then the second thing is like how to motivate healthcare professionals to, in a very conservative setting, usually thinking about this transformation process. So you break up the care process of a physician, so you force them to deliver care in a different way. And you can always do this by punishment or by rewarding the physician. And we strongly recommend by rewarding the physician. So this is what PCOR is also doing better than we do in Germany. Give them something. Yeah. Like they need a motivator to it's always painful to transform a process you worked in for years. And so you can do this in a kind way, and it will be like the game changer if you start a transformation very fast, or it will be a very slow transformation.
Indeed, definitely. Absolutely. All very good points. I would like to put forward, like, what do you see are the differences between being in a pilot phase versus in a real case scenario, between the regulation and the reimbursement systems? Do you have any thoughts about it?
Yes, I mean, probably one of the first steps when you are trying to introduce yourself as a early stage solution is going through a pilot case. We've been in lots of pilot cases, and if you are doing properly and if you can prove that your solution is good, it's a good case to enter to the healthcare system. Instead of showcasing different validation, is trying to show that you are able to offer a good service by creating a pilot. So I think pilots in healthcare are essential in a lot of cases, but it's true that we need to go one step further and try to avoid these pilots once we have approved data and we want to scale our solution. So I think once we have reached a more mature stage, we probably have more strong data and clinical studies that could make our path faster to get introduced in different health systems.
Absolutely. And when you're preparing the business models of your companies, your startups, how much importance, how much part do you dedicate to the reimbursement mechanisms, reimbursement then over other revenue generation mechanisms? How do you focus on that, and what advice would you give to upcoming digital health solution startups on how much focus and energy should they put there?
Yeah, okay. Do your calculation very conservative, of course, although they are called fast track and stuff like that. it will always take longer than you think to really ramp it up. Yeah? It's not just like if you get the clearance, then it will take some time till you really enter the market. Yeah, of course, like to your previous question, if you design like a pilot phase or test environment, yeah, calculate with these patients as well. You can keep them in your system, and they also can give you like a first revenue. Yeah, but really, please calculate careful. We did focus in our reimbursement in our business plan, of course, on the DiGA model. So we see the telemedical monitoring is increasing very linear and not like scaling up as a startup wants to see it. But don't waste too much time on it, because you will adjust your business plan pretty much on a daily basis.
Absolutely. And I think taking a sometimes you do need to take a conservative approach, to keep your balance sheets in check. So you have cash to burn for a long time. I want to go back to a point which Sergio mentioned earlier in his presentation. He mentioned that in order to enter fast track, you need to provide some kind of evidence. Can you describe more about what kind of what are the items that are evaluated here? What are the things that are seen? Can you describe more about these evidence, Sergio?
Well, it depends a lot in the requirements of the different market. These benefits are different for each market. For example, well, as Ralph mentioned, in France, in the Beacon system, the doctor must be involved, so it's very different with these requirements. So in terms of benefit for the patients, like in Germany, maybe Sebastian, that you have experience in the process to register a DiGA, can provide more info about these requirements for benefits for patients that they ask you to prove during the application.
Yes. So therefore, you have a pretty well-defined catalog of positive or like of primary endpoints which you can prove. It's basically like divided in medical and structural proof points, and you can decide on that. And like you just need to show really one proof point. It's not like you have to prove plenty or like a real health economic evaluation on that. Like if you show that the status, your health status, like we do it in our application in heart failure patients, it's the distance, the walking distance. Yeah, like we can prove that using our application really ends up in like a prolonged distance people can walk. Yeah, we can prove that life quality increases and that the therapy according to the guidelines improves as well. Yeah, and this all leads, of course, then to fewer hospital administrations. The emergency can be detected earlier and stuff like this. Yeah, but again, you just need to have one proof point. We aimed for more, to have like a better security. If we miss one endpoint, we still have other ones, which like gave us access to the reimbursement. But there's a very well-defined catalog, which I can share also in the community. Just text me.
Sounds great. Yeah, please, if anybody is looking for further information regarding this topic, please reach out to Sebastian.
Yes.
And he will provide you more information. We have a few questions coming in already, and thank you, Sebastian, for answering them earlier as well. So now we are almost close to the end, so we just jump straight into Q&As. Glenn has asked a further question to Carlos. He asks, do you have physiotherapists who are feeling threatened by or offering digital services instead of clinic consultations? And is this considered good by the payers or a threat to the jobs? This is quite an ethical and moral question, I believe. So, Carlos, if you can share any.
Yes, sure. Now, this is a great question. Probably lots of digital health solution has this question in mind. The thing is, this is totally that is something to us, and we are trying to inform the physio about all the value proposition of TRAK. when we offer our solution to let's say to a rehabilitation center where there are lots of physical therapists, our value proposition is to increase the productivity of these physios so they can offer more sessions in a hybrid model. This means that we do not avoid all the face-to-face consultation, but it's true that we reduce this face-to-face consultation. But the value proposition is that this patient or these physios can treat more patients and reduce waiting list. It's true that some practitioners are afraid and could not be like totally into this change, but when we apply this kind of digital health solution, I think we need to try to speak to the users, that's let's say doctors or other kind of healthcare professional, and try to let them understand what are the whole values. So it's something we in the company we are really conscious and we work really hard for it. And for the second question, if it's good for the payers or is a threat to the job, according to the World Health Organization, they recommend a ratio of 1 physiotherapist for 1,000 inhabitants. In Spain, we have 10 times less physio in the public health system of the ratio recommended. So at the moment, it's not a threat for the job. Actually, it's more a threat to the patients because the waiting list in the public system are huge. Solution like TRAK and many others came to solve this kind of problem. So in this case, I think they don't really get treated by the solution, but it's true that they might be feared by all the systematic change that may come with solutions like TRAK.
Absolutely. And I think with digital health solutions, they are meant to, they are meant to more empower people, and we should keep that in mind. And I think a lot of solutions these days, of course, they will cause a change in their operating systems that we do right now. But I hope these systems stabilize over time, and all the different players in the market can benefit from the person who's offering services to one who's receiving services. And I believe it will lead there eventually. Last question for the day. Like for the companies who have been through the DIGA process and the data that you have presented that was accepted in other country, what other information that you were required to provide? Can you share some details regarding whoever has gone through this process?
Maybe Sebastian, since you went through the process successfully.
Yeah, like of course we wish that the data is also accepted in other European countries, and we know, both Ralph and me know a professor who is really fighting strongly for a joint European clearance process. Yeah? So like if we need to bring new data, new clinical trials to every country, this is impossible for a small startup delivering 5 RCTs in 5 different countries. We simply cannot do that. Yeah? We see like the DiGinnovation program actually gave us the chance to come in contact with players from France. So we went at that time with Sanofi and Digital Pharma Lab, yeah, which knew the market, the regulators, but still there is no clear process in like your German fast track clinical trial will be accepted in Spain, France, or Italy as well. But it gives you at least the awareness and gives you argument in the system. So this is what we see, that we as a small startup got approached from bigger players, really helping us with their regulatory and market access specialists now, at least to scout in other countries. Yeah, and now we are able to. Yeah.
Okay. So, Ralph, any comments to that?
Maybe, as mentioned before, since Sergio mentioned that in Germany, for example, you are not supposed to have a healthcare professional involved. In France, you need to have one involved. That is a natural barrier in using the data from one country for the other. A good thing is that in Germany now they are discussing most of the involvement of the physicians, of the doctors. So maybe there's an alleviation there in the future at least.
Absolutely. We know that one thing for sure that we've learned today here is digital health solutions are here to stay. We need to improve these systems, these processes. And one way of that, and we need to keep talking about this, we need to keep discussing how are the things operated in one country to another. And only by through discussion, through collaboration, can we really make a difference and can we affect how the systems are being built right now. Because we are discussing here about not just the healthcare systems of tomorrow, but also of today. What we do today affects tomorrow. And with that note, I would like to highlight, so please join our innovators community is one such place where members come and discuss these topics. They bring various issues to highlight, and we put together, we can find other member experts whom we can connect with. And we want to build and help every one of you here build a resilient and sustainable healthcare system. And
visit community.eithealth.eu to join our community and shape the healthcare landscape with us. For more such videos, subscribe to our channel.